So we're joined by the GP, Dr. Azize Cissé. Thank you for joining us. I mean, I'm still trying to get my head around having a secret chickenpox party in a public place.
Yeah.
Not something that health practitioners would recommend, I presume.
No, not at all. Not at all. Chickenpox parties in general, but also chickenpox parties, particularly in a public space. So if we talk about chickenpox in general, we know that, yes, it's common. It's a common, highly contagious virus. And in children, it's often mild. We prefer for children to get it instead of adults, because unfortunately, when adults get it, they're at higher risk of getting the complications. So with chickenpox, it always starts off with feeling unwell initially, having a bit of nausea, and sometimes you get headaches and fevers and so on. And then after a couple of days, they get the traditional rash that we often talk about. It could be red or pink, but in dark skin, it could just be brown or even the same color, and then eventually it becomes blistered and scabs over. Now, how it passes on usually is that either it's through air droplets, so if they have a cough or they sneeze, or it could be from direct contact of the liquid from the blisters, or it could be from surfaces, though it doesn't live long on surfaces. Now, the reason I don't recommend it in a public space particularly is because the air droplets can live for several hours. And we know that if adults or vulnerable people, so this can be immunocompromised individuals, pregnant women, newborns, and these are people who could potentially be in these public spaces. If they get the virus, they can get the complications. But also, even healthy children, though often the symptoms are mild, they might rarely get the serious symptoms associated and the complications, which can include either brain infections, inflammation. They could also have something called Reye syndrome, which is brain or liver swelling. They may also get pneumonia. They may get bacterial skin infections. And in really, really severe cases, it could even lead to death.
So people will have heard very clearly what you're saying and get the whole thing about not doing it in a public place because you don't know who else is going to be there and the risks associated. But they might, even given what you've just said, say, well, I could do it in my own home, invite the people I know, and we all know the deal, we know the arrangement. What's the problem with that?
Yeah, well, this is what I'm saying, that even in healthy children, we don't know for sure how they'll react. Yes, it's more likely that it'll be mild, but there's a possibility, even though it's rare, that it could be serious. And as I say, in very, very serious cases, hospitalization and even death. Now, what we do have now is a vaccine. We didn't have that in the past, and that's why they used to do these parties more often, so expose the children who've not been exposed to chickenpox, so they get at a younger age.
However, at the moment, it costs money, right?
Yes, and I think that's what puts quite a few people off. So it costs around 120 to 200 pounds to get it privately. However, there are some individuals who can get it on the NHS. So these are people who are over 9 months old. You have to fulfill 3 criteria. Over 9 months old, never had chickenpox, and also you are living or you may be exposed to someone who could be immunocompromised or at high risk. However, the Joint Committee for Vaccination and Immunization in November 2023 have stated and recommended that we include it into the childhood immunization schedule because it's something that's done in many places, Australia, Canada, and the US. The US, actually, they've been doing it for 30 years, and it's 90% effective. Yeah.
You'll know, Doctor, that a lot of people, when they talk to GPs particularly, say, what would you do?
Yeah.
Yeah, they like your personal story. You've got children yourself.
Yes.
And you live in the real world.
I do.
Chickenpox has crossed your path?
It has. In fact, one of my colleagues said, it's a rite of passage. So my daughter had it when she was 3, and it was a difficult experience because, unfortunately, you can get the blisters in your mouth and also your genitals, and she had it on her vulva, so that was uncomfortable for her. I do have a 3-year-old who is going to get the vaccine for sure, and I would recommend it, particularly if you're concerned or if you think that you may be at high risk, if you have a family member who might be at high risk.
Sarah pointed out that some people can't afford that. They just simply can't afford that.
Yeah, I know, and I appreciate that, but it's looking at the risk-benefit, and actually, in this sort of situations, imagine you put yourself in a position where you've exposed your child to the virus, and unfortunately, if they were one of those children who had the serious complications, would it be worth it at that point?
Good to see you here this morning. Thank you very much.
Thank you so much for having me.
Thank you. Nice to see you.